Hey, this is Dr. Dukes and Dr. Ehring. We're going to go over the treatments that we would do with a shoulder pain patient, right? So the two that we're going to cover is an upper rib and clavicle adjustment, as well as a couple ways that we would do ART on either the front of the shoulder and the back of the shoulder. So we're going to start kind of showing the active release to the posterior part of the shoulder. So this would be Teres Minor, Teres Major, posterior delt, and we could even do some stuff where we might potentially work into the supraspinatus as well. But it's a really easy way for us to do things. It also shows people that the back part of the shoulder might need a little tissue work in a lot of cases. Instead of just thinking that it's weak and we need to strengthen, sometimes we can give it a little bit of a massage help, and that will help with the neuroactivity and changing the strength and the holding ourselves back in the proper postural position. So ultimately what we're going to do is I'm going to guide him through the movement, pressing on an area in his posterior shoulder with the Teres Minor, Teres Major area, the quadrangular space. Bring the arm across, and I'm going to teach him that movement, and then I'll let him do it, and then I'll tell him when he can go. That gives me a little bit more gusto with both hands back here, so we can really pin those muscles and move it through the plane of motion that we'd like to see. Okay, so if he were lying on his back, we could also work through the pec the same way. So I could find that area, pec major, pec minor, and then bring that arm out along that plane. And then once he's learned that plane, I'll have him do it, and then I can back my thumb up and he can work through that actively, which works better for the brain and the tissue once he learns it. Okay, so then the manipulation that we would typically work on for a shoulder patient is to adjust the clavicle or the first, second, and third ribs. So the way we like to do it here is we'll do one side at a time. And I'll kind of trap that elbow, put my hand right on his collarbone, and then take a big breath. So there we're getting not only the posterior part of the ribs back here, but sometimes we can get the front as well. So if this is something that is bothering you, or you've had issues with your shoulders in the past, feel free to reach out to us for a discovery call or schedule an appointment online.